today really is about that opportunity to expose them to all the different areas of medicine. And so by having the students down up in one of the stations and allowing them to physically take the role of the area that they're learning about.
A program like this, it introduces students to like healthcare careers, and it gives them like an idea of like, oh, like, is this something that I want to do, or is this something that's like not really for me?
Endeavor really showed that there's many different pathways you can take. There's many different options that you can do. You can also do something logistically and focus on the business aspect.
Yeah, and kind of on that, they like showed us other careers that we kind of don't know about, and you could really explore that.
And it's definitely making me lean towards one more specific profession, so I know what to go into when I go into college.
So my favorite station was actually the respiratory station. I think that I just get fascinated by the respiratory system in general.
The Stop the Bleed station at the emergency unit, it was very useful because we learned how to put on a neck brace for someone who was in a motorcycle accident.
It was really hands-on, and I like that we got to use dummies to see how to stop pressure bleeding.
Using like the tourniquet, that was something different that you don't really see a lot of.
I thought the sutures were really great. I thought that was a fun experience. It was not as easy as I thought it was going to be.
Yeah, and it was nice having people there in the stitching station, like right next to you, telling you what to do and kind of leading the way through it.
I really like when they tell us about their experience in school, and so we know what to expect.
There's a bit more insight from actual medical professionals.
And not only information like that you can just get out of a book, but like actual like their experiences, which was pretty informational for me.
They kind of gave us like how you would use it and where you would kind of use what they're teaching us, and that was really nice of them.
Making the bonds with people that we have representing the different types of medical fields there are made it seem a little more personal and personable, and show that the medical field is not so intimidating as it may seem.
It was good to have like very hands-on, that we all got to like try it and be in different positions, like either helping or actually being the one performing the act. So I enjoyed it a lot.